Hello everyone. There is a big psychological aspect attached with patients who have undergone surgery wherein some implant has been put, and a lot of patients they feel they have healed only once the implant is out. As such, implant removal can be done 12 to 18 months post surgery. So let us understand when we have to remove this implant. As a surgeon, there will be certain indications wherein I would advise removal. Certain implants are meant to be temporary, such as wires, pins. They are to be removed once the fracture heals. There can be some medical reasons for removal, like infection, right, failure of the implant. Usually in children, we advise implant removal because as children grow, the implants can get embedded in the bone and it becomes impossible to remove that implants later. And lastly, if the implant is in a place where it might impede in future surgery. For example, something around the knee joint wherein I would expect that the patient will undergo a knee replacement surgery in future. So in that case, I would advise removal of implant. So let us understand what are the relative indications for removal of this implant. The commonest is what we call weather vane. Patient will complain of aches or pains, stiffness whenever the weather changes, especially cold weather, humid weather, and they'll complain of pain. So that's a very common indication for implant removal. The second is prominent implants. So there are certain areas in the body, especially around the joints. So just imagine you having an implant around your elbow. Because there is no muscle cover, there is skin, you can feel your bone, you can feel your implant. And whenever you put your elbow on any surface, you will feel that irritation. So that's a common indication. So usually around the knee, around the elbow, around the ankle, these are the places where the implants are prominent and we want to remove it. Third is I just want it out without any reason, which so a lot of people feel that they don't want any foreign material inside their body, which is a very valid indication for removal of implant. And some patients do come to me and say that they are worried about airport security. Again, a valid point, but usually modern implants, modern scanners, they usually don't beep when you go through them. But that's again a common and a valid indication why patients want to remove the implant. Another indication for implant removal is sometimes patients feel that if they have implant in their body, they won't be able to undergo MRI scans. That might be a case earlier, but nowadays most of our implants are MRI compatible, and orthopedic implants usually don't impede in MRI scans, and MRIs can be safely done even if you have an implant inside. So let us understand what this second round looks like. During the first surgery, sometimes the recovery is slow, there is more pain, and patients are always scared whether the second surgery will also be so painful, whether they will have a recovery time. Usually that's not the case. The recovery is very fast because we don't have to wait for the bone to heal, so there is no downtime. Usually you are active immediately. But yes, there are certain activities which I would want the patients to avoid. I don't want patients to get involved in impact activities, heavy sports, heavy weightlifting, wherein there are chances of injury. Other than that, most of these activities can be comfortably done. So let's have a reality check. Will removal of implant fix all my problems? There's a good chance, 70% chance that your problems will settle down. But sometimes certain issues like stiffness, muscle injury, ligament injury won't recover with removal of implant. And there is good 20 to 30% chance that your symptoms still stays after removal of the implant. And lastly, whenever any patient is undergoing this implant removal procedure, they have this doubt that will the implant come out completely, or can we give any surety that the implant will come out? We cannot give you that surety because sometimes the implants are stuck, sometimes they are broken, and sometimes we feel that forcing this implant out would do more harm than good. So a surgeon might choose to leave a small part of implant behind, but that won't lead to any major issues and that will not bother you in the future.